Now, the reason it's a problem is because EMFs typically are microwaves, and microwaves get absorbed by the body. That's why we use microwave ovens, right? Because the tissue or whatever's in the microwave will absorb the microwaves. And as a result, what we know what it does, it heats, right? So if it's heating food in the oven, what's it doing to a body? It's heating. And the reason that it's heating is that microwaves themselves are extremely short wavelengths. So they get absorbed by the body.
Welcome to Vitality Made Simple. The following production is for educational and entertainment purposes only. If you need medical advice, call your doctor. Now, let's go to Vitality Made Simple.
Well, welcome to Vitality Made Simple. This is the podcast that equips you to feel better, look better, and to enjoy better relationships. So I've got Dr. William Pawluk today. Welcome, Dr. Pawluk.
Well, thank you very much, Dr. Osmond.
He is an MD, a pioneering researcher. He's very acclaimed in the whole functional medicine arena. But you know what's really awesome about Dr. Pawluk is he's a super nice person. And that really came through with your book. I mean, that's important to me, Dr. Pawluk. He's written a terrific book called Supercharge Your Health with PEMF therapy. Now, I'm going to be learning along with you. I've read the book, but this is an exciting field that I've really known nothing about. So, Dr. Pawluk, in getting started, I want you to tell our listeners the story about the 3 gastric bleeds that actually propelled you into the integrative medicine arena.
Well, the story goes back probably a long time, even a long time ago. I've been working with magnetic therapy now for about 35 years. So part of that journey was obviously, this is what often happens to clinicians and practitioners who do complementary medicine. So if you start off in sort of conventional medicine or conventional dentistry or conventional anything, right? Eventually you run into the wall. Eventually you realize that this is not enough. So it's working, it does certain things, but it doesn't do enough. And so that's why I call myself an unhappy doctor. I'm unhappy until I can solve your problem. And that means I may have to go out and do some research. I may have to go out and do some more reading and more learning and so on in order to be able to more comprehensively solve problems. I met a doctor along the way, actually from the UK, who had a holistic, essentially, back then it wasn't called holistic, but essentially it was holistic medicine practice. He says you got to learn 3 or 4 disciplines at least to be able to deal with 90% of the problems that walk in your door. Number one, you have to do something like natural medicine, like nutrition. You need to do acupuncture. You need to do environmental medicine. You have to take care of all the environmental stuff that contributes to health issues. And then if you do those things, and maybe you could do some hands-on therapies as well, manipulative therapies, then now you're able to basically deal with most of the problems that walk in the door without having to create a referral to a specialist or a subspecialist. So that stuck for me. So from that point forward, I began to acquire these disciplines. So I learned acupuncture, and I learned homeopathy, and I learned nutritional medicine, and I learned hypnosis for mind-body work, and so on. So I picked up all these different disciplines just so I could be more well-rounded. But in my journey to do acupuncture, this was in 1990 in the US, 1990, all right, acupuncture, what's that?
That's super weird, right?
What's that? And then until Madonna showed in her movie had acupuncture needles all up and down her back, people said, oh, that's acupuncture. Then most people said, stay away from me with those needles. They don't want needles. So that's how my journey sort of drifted over to magnetic field therapies, because I discovered that magnets will do acupuncture. And if you lay on a whole body magnetic pad or electromagnetic device, you're treating the entire acupuncture system. You're already rebalancing the whole acupuncture system. It may not be as focused or as targeted as you can do with acupuncture directly, especially if you do electroacupuncture. So in other words, you're using electricity to stimulate the acupuncture point. That really zooms the acupuncture system. So I started moving into magnetic field therapy because it solved more problems. It actually did something that acupuncture doesn't do that well, and that's healing. So you can heal tissues with magnetic field therapy. You can't really heal tissues so much with acupuncture. If your body's healthier, if your body's more vital and balanced, you can heal normally better, but you're relying on the body to do it. So acupuncture doesn't heal you. The body does the healing. No matter what we do, the body has to do the healing. Right? We're not bionic. We can't just replace an arm and reattach a new one and say, okay, we're fixed. Okay, so it doesn't work that way, does it?
No, and I appreciate the area I was heading to with your three gastric bleeds when you were still in conventional medicine is that you are curious. And I appreciate your curiosity. That comes across in your book so well, Dr. Pawluk. You weren't satisfied to just say, "Oh, here's the medicine for this," or "Here's the surgery for this," or whatever. You said, "I've got to learn some other things. I don't want my patients to be sick." So tell our listeners about the difference between EMF and then what your book is about is PEMF.
Good. That's a very important intro, if you will, to the topic, because there's a lot of confusion. So PEMF is still EMF, right? But it's pulsed. That's very different. So EMF, what I would generally describe EMF as environmental magnetic fields. That's not what EMF stands for. It stands for electromagnetic fields. But I consider that environmental. A cell phone is EMF. Wi-Fi is EMF, right? So those are basically a different kind of technology that was designed for other purposes. It wasn't designed for health or healing. Okay, it just goes right on through the body, goes out into the air. So it's distributed widely out into the environment, and human beings happen to be in the way. Now, the reason it's a problem is because EMFs typically are microwaves, and microwaves get absorbed by the body. That's why we use microwave ovens, right? Because the tissue or whatever's in the microwave will absorb the microwaves, and as a result, what it does, it heats, right? So if it's heating food in the oven, what's it doing to a body? It's heating. And the reason that it's heating is that microwaves themselves are extremely short wavelengths. So they get absorbed by the body. If you take a magnetic field and you broadcast it like you would an EMF microwave, a Wi-Fi or cell phone, the wavelengths are way beyond the wavelength of a body, the length of a body. So they go right on through. They don't get absorbed. So the key is the absorption. PEMFs are not absorbed and EMFs are absorbed. Now, there's another difference too. The EMFs are broadcast into the environment. As I said, they broadcast by towers that send out signals into the environment, just like radio waves, just like TV waves, just like radar. Okay, that's just broadcast into the environment. PEMFs are produced by a current flowing through a wire. So think of my thumb as the wire that's through which the current is flowing. So as current's flowing through a wire, it produces a magnetic field automatically. They go hand in hand. Electro and magnetic are inseparable. So when you have current flowing through a wire, you produce a magnetic field that's perpendicular. So basically we call that the right-hand rule. So this is the current, and the magnetic field is like this. It completely encircles the wire. So as the current flows, the magnetic field is going like this. All right, I move my tongue. I can't control moving my thumb. So the magnetic field is pulsing like that, but it stays in the wire. It goes out into the environment, and it comes right back into the wire. So it's basically a controlled magnetic field. So it's not really an environmental magnetic field. It's controlled by the current flowing through the wire. So completely safe, not absorbed by the body. It goes completely through the body, and then it comes right back out again. Into the body, comes right back out again. Right? That's the major difference between the two. So one is potentially harmful and risky. It causes some heating. If you're exposed to a lot of it, then it causes reactions in the body that we don't necessarily like. And what we have to do is we have to rebalance and repair the body after that kind of stress that's caused by the EMF. So PEMFs basically help the body in so many different ways. What they're basically is undoing the effects of the EMF, unless you have too much exposure. And then you're causing damage, because then you're causing DNA damage, you're causing cellular damage, you're causing membrane damage. All sorts of things can be happening. And sometimes those are easy to repair and recover, especially if you're doing magnetic field therapy right after an EMF exposure. I'll give you an example of how EMFs are absorbed. Look at somebody's ear after they put a cell phone to their ear. What happens to the ear? It turns bright red.
It turns red, yes.
So why is it turning bright red?
So that's the heat you're saying,
It's being
right?
cooked.
Wow. Well, Dr. Pawluk, this is so interesting. Years ago when microwave ovens came out, there was one of our family members who just everything went into the microwave, and he would use his left hand, he was left-handed, to put things in and out. And he had all of these age spots on his left hand that he didn't have on his right hand.
Right.
So those proteins, I guess, were just getting in his skin or getting cooked.
Well, although the magnetic field, once the magnetron is turned off, there's no magnetic field there. I was on Coast to Coast. I was interviewed on Coast to Coast, and we were talking about these kinds of things. And at the end of the interview, people were asking questions. And one guy at the end of during the interview said, "Well, I drilled a hole in my microwave, and I have a rash on my hand, and I was treating my rash with the hole in the from the microwave. So the microwaves were going through the hole into his body. Right? He was using the microwave to try to heal his body, but he's actually causing more harm, right? Because it's microwaves."
Yeah, well, and this was in the old days. This is probably, I don't know, 40 years ago when
Where they probably were
microphones
leaking
first,
more and
they
so
were,
on.
yeah. I'm sure. Hopefully, that's a lot better now. Well, Dr. Pollock, you call
Well, one way to know whether your microwave's leaking,
Yes, how?
put a cell phone in the microwave oven. You don't turn it on. Just put the cell phone inside the microwave oven and call it. If the cell phone rings, it's leaking.
Wow, because that microwave should be so tight that it's like a Faraday cage, right? I mean,
Exactly.
uh-huh.
It blocks the magnetic fields or the EMF coming from a cell phone or from the ringer. So yeah, so that's a way to tell that whether you have a leaky microwave or not. If you do, better get rid of it.
Well, that's information we can really use. You term this PEMF therapy as a Swiss Army knife. Explore that for us and help us all understand what you mean by that.
Okay, so and that's a very good question, and I use that term Swiss Army knife for a reason. So in the book, I outline 27 different actions that have been scientifically validated, right? The actions of how the body reacts to a magnetic field. And all of those reactions are healthy reactions. So I mentioned acupuncture as one of the actions of magnetic fields in the body. It stimulates the acupuncture meridian system. And we have evidence of that. In fact, I teach acupuncturists a whole day course on how to use magnetic field therapy to stimulate the acupuncture system and to help with the repair and regeneration. So you can help with the repair that the acupuncture can't do. But if you combine the two, you get the benefits of both.
Wow, that's fantastic. So you outline a lot of areas. Where do you see some of the strongest benefits?
All right. So because one of the most important aspects of magnetic field therapy, and the one I rely on the most, is to reduce inflammation. So 40 to 60% of the reasons that people visit doctors is for pain. But what we don't do is we don't want to be a pain management doctor, which is basically just load you with drugs to try to, I call it numbing and dumbing, to numb you and make your brain dumb so that you can't feel the pain. But that's not healing anything. So as soon as you take away the Tylenol, or as soon as you take away the opioid, the codeine, then what happens is the pain comes back because you haven't dealt with the cause. So magnetic field therapy deals with the cause, because it's not only helping to repair the tissue that was damaged at producing the pain, All right. But it's also taking care of the pain. So magnetic field therapy does have a natural pain killing effect, just like codeine or Tylenol. Right. But in addition to that, it's actually stimulating the tissue to begin to regenerate and reduce inflammation. So inflammation and pain reduction are two of the most important actions of magnetic field therapy. You improve circulation. You open up the blood vessels. We talked about cooking the ear. Well, magnetic fields don't cook the ear, but they do dilate the blood vessels in the ear. And so you will see an ear turn reddish with magnetic field therapy. I did this with hands. I did magnetic stimulation of a hand and it turned red. And I looked at the other hand and it turned red too. Not as much, but it also turned red. So whatever we're doing to stimulate the circulation in this hand is actually having an effect on the whole body. Not as much in the rest of the body, but at least it's having an effect on dilating the blood vessels. So improving circulation, what does that do to the body? Brings all the healing actions to those tissues, right? So that and regeneration. So you bring the healing actions in. So you stimulate what we call fibroblasts. You stimulate the production of collagen. So all these different actions of magnetic fields are happening at the same time. I don't decide, and the magnetic field doesn't decide what the body's going to do with that stimulation. The body decides. And because the body now has at least 27 different choices of healing, of mechanisms or actions of healing, then you'll see a progression of changes or improvement in the tissue as the body begins to heal itself. And it will heal the first things first. It'll improve circulation right away, immediately. But improving circulation then helps with the healing and the deep reduction of inflammation. You can't heal if you have inflammation because the tissue is irritated. So you have to reduce the irritation, you have to reduce the inflammation, have to reduce the swelling of the tissue caused by the inflammation. When you do that, then the body begins the healing process. So all of these things happen in sequence but the body controls. I don't control it. I'm not smart enough. And thank you. I appreciate the body doing the work that it does. So we just give the body a chance. What we're doing is giving the body a fighting chance. Now, you can't regrow a limb. Magnetic fields are not going to regrow a limb, not like salamanders. Humans have lost that ability. Although I do have a case, one of my own cases, where this 3-year-old child cut off the end of her thumb in a door jamb, a sharp door jamb. Literally just ripped it off. And the father called me before the surgeons had at it. And what the surgeons would normally do in the medical system, they would clean up the wound and let it begin the healing process, and then put a graft on it. Take skin from somewhere else in the body, put that on top of the wound. Well, that child, 3-year-old child, would have had a deformed thumb for the rest of her life. So I said, let's use the part of the finger that was torn off, sew it back on again. And that will serve as a bandage for the wound. So the wound is not exposed to the environment. And then she did magnetic field therapy for an hour to an hour and a half a day. So it's in my first book called Power Tools for Health. I have pictures. 12 weeks later, she's regrowing her nail. I've never seen that before, ever.
Incredible. I mean, I know that our bodies are designed to heal. And I like how you say it's not one thing. It's like sort of like the onion. You take the layers off, and then the body has more energy, more resources to heal.
Behind it to finish the healing. Yes.
Mm-hmm.
One example of magnetic field therapy for healing wounds, healing sores and wounds and cuts. The FDA has approved magnetic field therapy for healing fractures that won't heal. So a small percentage of fractures, broken bones, don't heal. And what they've discovered is that the magnetic field therapy will reinitiate healing in a fracture that's long since not been able to heal itself, even 5 or 7 years after the fracture. And all of a sudden, the healing processes of the body wake up. And when they start doing the magnetic field therapy and they're using the right machine, depending on the machine they're using, they could be needing to use it for upwards of 9 hours a day. And 9 hours a day of stimulation with a low intensity magnetic field. And 3 months later, the fracture's healed. Prior to that, stalled healing is now healed.
Wow. Okay. So how would that impact, say, joint replacements? I mean, wouldn't this be a good co-therapy?
Oh, absolutely. And there's several reasons for it. So number one, a joint replacement means that you cut through the bone, you remove the bone beyond the joint. and you stuck a rod in that bone to stabilize the bone, right? Now, a rod is not something a bone or a body likes, right? Bodies don't like foreign bodies. They don't like
Right.
stuff that's not them inside themselves. So what happens is that rod then serves as an inflammatory source. It's a source of inflammation. And this is why these bone joint replacements 15 or 20 years later have to be revised or re-replaced because they've caused their own damage in the body. And so magnetic field therapy then stimulates the tissues, decreases the inflammation that's caused by the body's reaction to the foreign material, and heals the tissue. And so you get better what we call osteointegration.
Mm-hmm.
So again, healing happens. Now, it's not completely healed because you still have the foreign body in the body, right? But at least you're decreasing the inflammation and allowing that joint replacement to last much longer.
Is this similar to grounding? Like,
Good question. It's okay. I consider grounding ancient art.
yeah, that would be earthing for our listeners, grounding.
Earthing and
Yeah.
grounding, yes.
Getting
So
outside barefooted or, laying on the ground.
so what does that do to the body? Acupuncture. So what it's doing is it's stimulating. So if you wear a copper bracelet, which is basically equivalent to grounding and earthing, right? So the copper has copper ions, and those copper ions from the metal in the copper are interacting with the sweat, metals and minerals in the sweat. And so you get what we call a dielectric. You get a little bit of current flowing back and forth between the body and the copper. And that little bit of current is enough to initiate healing responses in the body or rebalancing, basically. But it's very, very, very weak. And in nature, that's why I say it's ancient. So if we didn't have access to PEMFs 100 years ago, 200 years ago, or 2,000 years ago. So walking in nature, being exposed to minerals in the ground or the earth, or even hugging a tree for that matter, you're producing energy. There's an energy exchange, and that energy exchange can be amplified by the body to help the body be healthier. But you can't heal a non-union fracture with earthing. You can't heal a pneumonia with earthing. Now, you may be able to prevent a pneumonia if you're doing regular earthing and you don't have a magnetic field. But if you have a magnetic field, it's much stronger than earthing, much stronger. So if you're doing magnetic field therapy, you have your own whole body magnetic system and you're doing treatments on a regular basis, daily basis, typically, you're taking care of business without having to do earthing. Now, it doesn't mean that you shouldn't hug a tree.
Yeah, or take a barefoot hike, or that's all fun.
There's other values in that. But if you're trying to heal something significant, some significant injury or health problem, then you need something strong, much stronger, and magnetic fields are much stronger.
I appreciate that clarity about the copper bracelets. I've never understood why people wear those. That's fascinating. So, Dr. Pawluk, tell us about the cell injury model.
All right. So every cell in the body, and we have about 100 trillion, has its own work to do. Pardon me, excuse me.
Bless you.
Thank you. Has its own work to do. And every cell is trying to maintain itself. So if I slap a cell, like I slap your body, then you're going to react. So the cell reacts to any injury, and it has to react and introduce processes in the cell that then begin to recover and repair the cell. So lack of ATP production, mitochondrial damage, the movement of ions in and out of the cell, inflammation, DNA, all of that is part of what the cell machinery is. And if it's damaged, that cell machinery kicks in to try to repair itself. But it can only repair to a point. So if the damage is too much, the cell basically dies. So it could die naturally. So our cells are constantly turning over all the time anyway. Our whole body. Every 7 years, we're being told that we're a whole new body. Well, actually, our corneas are new every day, right? And our gut cells are new every 3 days. And our skin is revitalized probably several weeks for the skin to become new again, essentially. right? Ligaments and tendons don't repair or replace very easily. So there's normal cell turnover then, and the cells in different tissues of the body are turning over at different rates. So the reason we're a new body every 7 years, it takes about 7 years for the bones to turn over.
Well, and to think about that improvement in collagen, boy, that just helps every single area you've mentioned.
Everything, exactly correct.
But
But then you need a magnetic field that's strong enough to go through the body, that's going to go deep through the body, going to go all the way through the body with a sufficient amount of magnetic field intensity to be able to do the work that needs to be done. So let me explain that. Inflammation. We talked about inflammation, how inflammation is so important and how PEMFs really are important for inflammation. There's a but. And the but is that you need the optimal magnetic field intensity needs to be 15 Gauss. So Gauss is a unit of measure of the intensity or the strength of the magnetic field. So you need 15 Gauss at the target tissue to maximally stimulate the reduction of inflammation. But magnetic fields are like light and sound and heat and cold. The farther you move away from the source, the more rapidly the signals, the stimulation decreases. So magnetic field therapy is just like that. So if you have to have radiation therapy, the radiation therapists, the oncologists, radiation oncologists have to calculate the dose. They want to deliver a certain amount of radiation at the tissue to kill the tissue that you're trying to kill on purpose. Then you need to calculate that dose. Well, with magnetic field therapy, you have to calculate the dose. And in the book, Supercharge Your Health, there's an appendix about inflammation and PEMFs and adenosine. So this property of magnetic field therapy to reduce inflammation works. One of the mechanisms that works through adenosine receptors. Adenosine is part of ATP, adenosine triphosphate. So ATP is the energy source molecule in the body. And so what happens is the magnetic field therapy stimulates the adenosine receptor, which then decreases inflammation. But you need 15 Gauss at the adenosine receptor to do the job. So if you have a magnetic device that you purchased that's only 1 Gauss, are you going to deliver 15 Gauss into the body? You're not even delivering 15 Gauss at the surface because you don't even have 15 Gauss. So always, 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 always ask what the intensity of the magnetic field device is that you're buying. And unfortunately, if you already bought one that's only 1 Gauss, well, you're going to have some benefit, but you're not going to have enough benefit to do deep healing work or deep inflammation reduction work. So for anti-aging, you need 15 Gauss deep into the body to be able to do a more effective job of decreasing inflammation.
Dr. Pawluk, what do these devices look like? Describe one for us.
Oh, good Lord. Well, there are all kinds. Here's one that's very simple. This one happens to be called the X-pulsor. So that's battery operated. It's a battery here. And you just basically just turn this machine on. There's a flashing light. Right? You can see that.
Yeah. This will all be on YouTube for the people hearing it on the podcast, but he's giving a great demo here.
All right. So the coils are where the magnetic field is coming from. So the current flowing from the battery, from the control unit, flows through the wires into these coils. And the coils themselves then are producing the magnetic field. Right? And then what you do then is you could apply the magnetic field to a shoulder. You could apply it to a head or a face or tooth or sinuses. This device happens to be designed for sleep. So you put the coils in your pillow, on top of the pillow, inside the pillow cover, under where your head would normally rest, and you're going to hear a clicking. The magnetic field is going into the brain, and it's causing the brain to slow down. Okay, that's called delta. So this is delta sleep enhancing. Now, there are similar devices to this that are not specifically designed for sleep, but all of these, including this one, even though it's designed for sleep, it can still help with inflammation because the magnetic field doesn't care. It's just got to be the right strength to do the job. So this is a very simple device, which this costs about $400 on drpawluk.com.
Okay.
So
yes, I wondered about that. That's
so
PAWLUK. I'll have all that. I'll have all that in the show notes for everybody, Dr. Pawluk.
So my website, drpawluk.com, there's a product comparison guide. And that product comparison guide gives you a list of all the different devices that I work with. and devices that I recommend, and I've tested and I've evaluated and I recommend. So there's little devices like this, and then there are big boxes. So the big box is the control unit, and that control unit generates the current that has to flow through the wire to go to a coil, or what we call an applicator. And it's the applicators that you put on different parts of the body, whether you're laying on a whole body pad, or whether you're laying on something that's going to treat a whole shoulder, or whether you're going to treat a heart or lungs or a hip or a knee. So the applicators are where the treatment is done. So each device then has its own applicators essentially, and there are different kinds of applicators for different applications. And so the applications then determine the benefits and the results that you're going to get. So again, you go from very small to very big. So the best thing to do, I have samples in the book as well. There are pictures in the book of different devices, and I talk about the variations in those devices in terms of the intensities and the applicators that are used, so how strong they are, the kinds of applicators and so on. So that book then has some of that, but also drpawluk.com is probably better in general in providing you with visuals and even videos on how these things work.
Talk about any potential side effects, overuse, potential problems, Dr. Pawluk. I know our listeners are thinking, ooh, is it all good, or can there be a problem?
So the answer to that question is a very, very important question. The answer is magnetic field therapy does not cause problems. It reveals problems. So if you're applying a magnetic field to a body and there's a problem in the body as a result of the magnetic treatment that wasn't there before the treatment, then the magnetic field therapy is revealing a problem. I'll give you an example. I was working with a guy who was really buff. He was really a real athlete and hobbyist, and he was a very, very fit person. And he put one of these little magnets on his knee, and the pain increased. So he had pain, but the pain increased. And then he said, this is a piece of crap. It's causing my pain to get worse. So he stopped doing the therapy, went about doing other stuff, came back, and the pain was still there. So he tried it again. And we said, you better go see a doctor. This is not supposed to be happening. Because you're having this problem, it's telling us that you have another problem that we're not seeing. So he went back to an orthopedic surgeon and discovered that he had infection in his knee. He had septic infection in his knee. If he had not taken care of it, the magnetic field had not revealed it, he would have gone on to destroy his knee with the infection. Right? So we caught it early, and then we were able to do a definitive treatment for the knee, and then he could come back with the magnetic field therapy then to heal the knee and recover the knee from the problem that was going on before. So PEMF therapy doesn't cause problems, it reveals problems. There's a however. And the analogy that I'm going to use is running a marathon. You don't get off the couch and try to run a marathon. You can try. Good luck. I feel sorry for you. What you better do is you better train. Right? So you have to train for at least the marathon that you want to run. So if you want to run a 2-mile marathon or a 5-mile marathon or a 20-mile marathon, well, then you're going to have different kind of training for each distance that you're going to try to run, right? Now, if you train for a 20-mile marathon and you only run a 2-mile, you'll just breeze right through it. So, but you got to train. And what happens when you train? You won't like it. You can go easy, which is going to take a lot longer, or you can go hard. Right? So if you're going to go hard, it's going to hurt. And you're going to have to recover from the training. And you train some more, and you recover from the training, and you train some more until finally you can get to your goal with training, be able to run a full marathon. So magnetic field therapy is a bit like that. It's causing your body to work, and your body's not used to that kind of work. So what happens is that you should go gently. And on drpawluk.com, there's a blog called Going Low and Slow. And there's 3 protocols: fast, normal, and slow. So if let's say just recovering from surgery, you probably want to be more gentle. If you have autoimmune disease or you're sensitive to everything and your body is just not functioning very well, you're going to have to be a bit more gentle. which means you're not going to realize the full benefit of that PMF therapy until you get to the maximum time that you can do treatment. So the goal is to try to get to maximum intensity and maximum treatment time. Maximum treatment time typically is about half an hour. And the maximum intensity would be the maximum that that machine could put out. But again, if you have a machine that's only putting out 1 gauss or 4 gauss, well, it's not going to stress you a whole lot. But if you have a machine that's putting out 10,000 gauss, then we have those kinds of devices. Most people, for most people's purposes, you need typically somewhere around 4,000 gauss. Because what you're doing, people are often very limited in the way we think. We have a goal to solve. We have a wrist pain, a carpal tunnel problem. We say, well, all I need this for is carpal tunnel. But magnetic field therapy deals with the whole body. So you can either do that, just do the carpal tunnel problem, or realize that magnetic field therapy could be helping me to be from an anti-aging perspective, from a wellness perspective. And so you don't know you have a problem today with your carpal tunnel, and 3 days later, or a week, 2 weeks later, or a month later, you sprain your elbow, you fall down, right? Or you get whacked on the head, you have a car accident, and you get whiplash. So now you need something much stronger. So if you can, you should try to go to the best device you can get, because you're buying it for the rest of your life, essentially. And we're trying to anticipate what we're going to need it for, because every insult that we have in our bodies ages us. So I call aging death by 1,000 cuts. And they're not all deep cuts, right? They're just, all these small little niggling injuries that we have with our lives age us. So if you have a tool like a whole body magnetic therapy device that's strong enough, then you recover faster from all of these insults. And in addition to that, what you're doing is you're optimizing the body, you're raising the vitality of the body so it recovers better, faster from almost anything. I told you about the little girl with the thumb. And we see this in Finland. They were looking at people who had massive trauma, big car accident, right? Lots of broken bones and torn tissues and so on. And these people would often be in the hospital for 4 weeks, 6 weeks or more. When they started doing magnetic field therapy, whole body magnetic field therapy, they recovered, they cut down their hospital stays by over 2 weeks.
Oh, that's incredible. What are you seeing, Dr. Pawluk, in terms of long COVID?
Magnetic field therapy. Now, during COVID, if you actually have an acute COVID infection, you have to go low and slow, because all of a sudden you're flooding the body with circulation, with increasing the circulation. Mm-hmm. And one of the reactions of the body to increase circulation is inflammation. Now, in the long run, you're going to decrease the inflammation, but in the short run, because you're producing so much circulation increase in the tissues, you're flooding the tissues with inflammation. That's important. And that's important to go through the healing process. But then you need to continue the treatment so that you're converting over from acute inflammation to mild chronic inflammation, and then the healing. So with long COVID is a systemic problem, right? It's a whole body problem. You can have heart problems, you can have brain problems, you can have heart problems, you can have gut problems, liver problems, you name it. So because it's all inflammation based, what you're doing is you're decreasing the inflammation. If you decrease inflammation, you feel better. But then you not only have to decrease inflammation, you then have to repair the damage caused by it. So, for example, another example is Lyme disease. Mm. Okay, so magnetic field therapy is very, very, very important for Lyme disease. Why? Well, number one, you have the acute infection first, and maybe you see a bullseye. Most people with Lyme disease have never seen any bullseyes, right? So if you see a bullseye, then the magnetic field therapy will very, very rapidly decrease the inflammation. I'll give you an example. Relative to that, I had a little bite on my leg, a small bite. I looked down on my leg and I didn't even know I got bit. And I had a quarter-sized wound there. Inflammation, redness, itching, so on. So I put a magnet on that wound, on that bite. 3 hours later, gone. How long does a spider bite last?
Oh, days.
Days, weeks.
Yeah, weeks, right? Depending on the spider. Yeah.
Exactly. And depending on the depth of the bite and the condition of the body and so on. So I got rid of it in 3 hours.
Wow. So, Dr. Pollock, what are you seeing in terms of Epstein-Barr? I'm seeing too much reemergence of this virus in clinic lately.
All right. So all infections, regardless of the cause, all viruses cause inflammation, which then causes damage. And the amount of damage is what we have to recover from. So, number one, we want to limit the inflammation, we want to limit the infection. And when you give the body more vitality, the body can fight better. And because it can fight better, you shorten the course of inflammation. Magnetic field therapy stimulates the leukocytes in our body, the white blood cells in our bodies. By stimulating the white blood cells, now you're marshaling the immune system of the body to go into action. So it's not going to sort of la-di-da into action. It's going to go, let's fight this. It's going to be aggressive in fighting it. And that's what limits the problem. So with Lyme disease and EBV, with Lyme disease, what you're doing is you're decreasing the acute infection, but you're also decreasing the chronic infection. So the Lyme organism burrows itself inside the cells and it serves as a source of recurring infection. So Lyme disease has the acute infection and it has the chronic infection, it has the immune problems, and it has the damage. So all those four components happen with Lyme disease, as happened with almost all infections. So what you're doing then is you're marshaling the body's ability to fight it. So it shortens the course, decreases the severity of the course, and you recover faster and you heal the damage. And if you're doing this on an ongoing basis, as early as possible in the course, because the later you are in the course, the more damage has already been done, the more damaged tissues has been done. And really damaged tissues, take a lot longer to recover. Right? Especially when you do it with whole body. And then you have to make sure that you have the right machine.
Yes, and unravel for us the difference between PEMF and red light therapy.
Okay, that's very important. And so in the book, I also talk about complementary therapies. And red light therapy and laser are complementary therapies. I've looked at all these therapies. Again, try to solve all problems, right? And so what I found is that red light therapy has its own benefits because of the different wavelengths and the frequencies in light, in the red light. But it's very shallow because the wavelengths are so short. Like microwaves, they're very short, and so they get absorbed by the body and they heat to some extent. So you have to control the amount of heat so you don't cause damage, but you still want to get the benefits of the red light. And magnetic field therapy does not heat. And it goes all the way through the body, completely through. It's not limited. So red light is more shallow, but it has different frequencies. And you combine the two, red light and magnetic therapy, you're going to get even better action than with either one alone. We see the same thing with ozone. We see the same thing with hyperbaric oxygen, or virtually all other therapies. Every one of them has their advantages, their strengths and their weaknesses, their do's and their don'ts. And magnetic field therapy, that basically complements virtually anything that you're going to do. But how many different machines can you afford? And do you want to keep going to a doctor's office to get treatment? So eventually, if you could solve the problem in 5 or 10 visits, great. But if you can't solve the problem in 5 or 10 visits, let's say you have a non-union fracture, it's going to be a lot more than 5 or 10 visits because you got to do 9 hours a day with some machines. You have to do 9 hours a day for 3 months. Can you do that in a doctor's office or a clinical practice? So you have to then make the decision on when you're going to convert over to having your own therapy system. So if you have a red light and you have the magnetic fields, it'll go faster. It'll go better faster. But you don't have to buy a red light machine to get the benefit. So what I usually say, buy one that you can afford. Buy the right PEMF device. See what it's doing for you. And if it's taking care of business and moving you fast along the line of healing, then that's all you need. But if you're not moving fast enough and you can afford it, go get red light therapy too. Now, you can't really use them at exactly the same time easily because the magnetic fields can interfere with the electronics of the red light machine. It's not going to interfere with the applicators, but it can interfere with the electronics.
Wow. And no, I think to have it at home in the long run, that's going to be a lot more economical than paying per visit. Insurance is not going to cover it. Of course, all these wonderful integrative therapies are not at this point in history, at least. Maybe that's going to change. but also going somewhere. When people can do things at
This
home, they're more likely to do
the
it.
disadvantage. But not only
Mhm.
that, again, it has to do with how often you're doing it.
Mm.
My normal recommendation for people is to do it twice a day. So if you have a whole body magnetic device, you should be doing it twice a day, 30 minutes twice a day, even without a problem. Why? If you do it first thing in the morning, you get rid of the cobwebs from the night before, right? Do it at the end of the day, you're getting rid of the stress of living a day. It may not feel stressful to you, but it's a stress to the body. Living is a stress to the body. The body has to do work to live, to function. So if you're doing it first thing in the morning, you're waking everything up. Do it at the end of the day, you're shutting things down, and you're doing it safely. So you're basically creating an environment then that is more inducive or conducive to proper sleep or good sleep.
Wow, this is super fascinating. I think it's very empowering for our listeners to
Empowering.
know that there's something they can do to enhance other therapies they're currently using, to enhance their physicians' outcomes.
Right.
Um,
And sometimes you do need the physician. If you need to have a cut, you
sure.
need to cut something to cut out an abscess or something. Well, then you need that surgery, but you want to heal faster. I'll give you another example for myself. I had to have an elective appendectomy. I had to have my appendix removed because there was a tumor in the appendix. It turned out to be benign, but I had to have that removed. And so I had a laparoscopic procedure. So I had 3 stab wounds in my belly with the laparoscopy. I used my little machine, put 2 coils on 2 stab wounds, and the other one I just sort of left to for its own devices, for its own resources, and cross your fingers. I had my procedure done on a Friday afternoon, and I was back to work on Monday. So I continuously treated, continuously for the whole weekend. The wounds decreased in inflammation, the pain and irritation were gone. Now I still hadn't finished healing those wounds, but they were good enough, they were well enough that I could go to work.
Well, and I think that might be a real valuable thing to have traveling. Um, not just airports, but just traveling generally, how things happen and how,
Mm-hmm.
time zones can mess you up. I would think that it sounds like it sort of maybe relaxes your brain, puts people into parasympathetic.
I use this in airplanes all the time, especially the red eyes. I call this flying delta.
Flying Delta. Yeah, that's right. Getting into that Delta waves. Oh,
Yeah.
that's great. Well, this has been fascinating, Dr. Pollock. I want to again tell our readers your book is called Supercharge Your Health with PEMF Therapy. It's a real usable guide, as he mentioned. You can look up something. Okay, I just opened it up, and obesity pops up. Then osteoporosis pops up. I mean, there's a alphabetical guide that's super helpful. I thank you for that. I thank you for your curiosity and your willingness to share your knowledge. You're really quite energetic in telling everybody about this amazing technology. So, once again, Dr. Pollock, tell people how they can find you, and I'll put all that in the show notes also.
I just strongly recommend that if you're going to invest in a PMF device, getting a book is a great idea. For $29 to buy the paperback, and you're going to be investing 5,000, 6,000, or way more for a magnetic device. You should know about it. We do offer consultations for people who have significant illnesses. I mean, if you just have a torn nail in your foot or your hand, you don't need to consult with Dr. Pawluk. But if you have Lyme disease, or if you have a long haulers syndrome, or if you have EBV infections, or anything that's chronic, any autoimmune disorder, we do consultations. So on the homepage, drpawluk.com, you can apply for a consultation. And then we'll get you into the right piece of equipment and explain why, and then how to use it, how to get the most value from it. Because again, you're making an investment in your health. I also need to say, I tell people all the time, when you buy a PMF device, you don't own it. The house owns it, including the dog, the cat, and the plants. So everybody in the house can benefit from it. Doesn't matter the age, gender, doesn't matter what the health conditions are, except that you may need to go low and slow. right? So in other words, it can be used by anybody in the house. Once you have this resource, this healing resource, it's so safe to use. Dogs, people who have dogs, their dogs or cats will come over to them while they're doing their treatment almost every time.
Wow, healing resource. I like that. That's a great term. Well, thank you so much for your time.
My pleasure.
And thank you, listeners, for wanting more vitality. Dr. Pawluk used that word several times, and I appreciate that. We want more vitality. We want to live life to the fullest. We want to enjoy the days we've been given. We want to enjoy our relationships. And thank you all for sharing this. We're now in 136 countries, and I think approaching 5,500 cities. And it's because you're sharing. Join me on Instagram, having some fun there. And check out Dr. Pawluk's website, order his book. I've really enjoyed it. It's sort of a manual to refer to. And just keep doing things that give you joy. Keep investing in your relationships. Blessings until next time.
Thanks for joining us on Vitality Made Simple podcast. Be sure to visit drdebbieosment.com for our courses and resources designed to help you feel better, look better, and enjoy better relationships. Please remember to like, subscribe, and share. Thanks for joining us.